Thank you for your desire to better understand traumatic brain injury and how it impacts behavioral health. While watching this video, you can follow along with our one-page printout that highlights the key aspects. Use the QR code on screen to go to our website and download our TBI informational outline. So, why all this concern about brain injuries? Traumatic brain injuries, or TBIs, are often misdiagnosed, go undetected, and mild cases are commonly not tracked in the medical community. And for those that are detected, approximately 2.8 million ER visits, hospitalizations, and deaths occur in the US each year. Therefore, it is critical to know, understand, and screen individuals for a history of head injury. Knowing will help inform you on the challenges that come from a TBI, how to make simple accommodations, and how to plan for better treatment outcomes. After watching this video, you will be able to identify what is a TBI and when does it occur. TBI neurobehavioral challenges. What is the TBI silent epidemic and its prevalence in behavioral health? And considerations in treatment of individuals with a TBI. What is a TBI? Traumatic brain injury is a common neurological condition that results from an external force to the head that alters normal brain function. The fingerprint of a TBI is an injury to the frontal areas of the brain, regardless of the point of impact to the head. Once there is enough force on the head from a blow, shake, or blast, the brain can jiggle like jello within the skull to cause bruising, bleeding, swelling, and/or lack of oxygen to the brain. The TBI requirement of an external force clearly separates it from other acquired brain injuries that occur after birth, such as stroke, tumor, anoxia, or shock. Here are a few TBI facts. Effects from a TBI may be temporary or permanent. No two brain injuries are alike. Males are twice as likely to suffer a TBI than females, and after the first TBI, the chance of having a second TBI is 3 times greater. Causes of a TBI. TBIs happen around us every day. A TBI can occur from any of the following: falls, more commonly in children and older adults; vehicle accident; recreational boarding accident; intimate partner violence; sports injury; shaken baby syndrome; child abuse; near drowning; strangulation; gang violence; criminal activity; gunshot; overdose; and combat injury.
I sustained my brain injury by being attacked outside of a establishment in Birmingham downtown.
6 months after we got married, my survivor and I were in a four-wheeler accident at a four-wheeler park.
On my way to work at 4 o'clock in the morning, heading to Edinburgh Power Steam Plant, and I had didn't get no sleep the night before, and I got close to the job and fell asleep under the wheel and hit a tree.
A passenger in a high-speed motor vehicle accident.
I was on a university field trip, and we were looking or surveying rocks on the side of a road, and a car ran off the road and hit one of my classmates and hit myself.
My traumatic brain injury was sustained due to a car accident.
Well, it was a normal Sunday afternoon. I was driving around my mum's for a cup of tea, and down the road I've been driving down at that point for a long time, 10 years or so, and I lost the rear of the car going around a right-hand bend, and the car slid sideways and crossed the central carriageway, and I hit a car coming the other way.
My traumatic brain injury occurred in July of 2016 from falling off the roof of a 3-story building.
What are the levels of TBI severity? TBI varies greatly based on the effect on brain function. Alteration in function can range from a brief disruption in thinking, such as being dazed or confused, to being in a coma during which the brain is not able to respond to pain or other strong stimuli. There are 3 levels of severity: mild, moderate, and severe. A mild TBI is also known as a concussion, which occurs in 80% of all head injuries. A concussion generally resolves in a few months with rest and appropriate support. If a concussion doesn't resolve, then it can turn into post-concussive syndrome. This is characterized by symptoms occurring past the normal 30 to 60-day recovery period. A moderate TBI occurs with a loss of consciousness from minutes to hours and occurs 10 to 13% of the time. And a severe TBI occurs when the loss of consciousness is 6 hours or more and happens 7 to 10% of the time. All levels require recovery after a hospital discharge. Effects of TBI. The lasting effects of a TBI depend on three things. First, whether there are multiple injuries. Second, at what age they occur. And third, whether the individual already has another source of compromise to brain function. Effects can be temporary or permanent. It is important to be able to recognize key effects when interacting with an individual with a previous TBI. Let's cover some of the effects of a traumatic brain injury. Neurobehavioral challenges may include 4 specific areas: thinking and processing, sensory, physical, and behavioral. Some of the thinking and processing challenges may include memory loss, problem solving or reasoning, comprehension, impaired judgment, language and/or aphasia, new learning. Sensory challenges may include sensitivities to light, noise, hot and cold, hearing and vision impairments, diminished taste or smell. Physical challenges may include extreme fatigue, headaches, sleep disturbance, seizures, balance, coordination, weakness on one side, paralysis, speech, slurred or impediment. Behavioral challenges may include new onset or increased depression and/or anxiety, impatience or impulse control, increased self-focus, socially inappropriate behaviors and expressive language, aggression or agitation, perseveration, which is being stuck on a word, item, or subject, irritability and frustration, social isolation, difficulty initiating, unrelated laughter or crying, lack of awareness of excessive talking or personal boundaries.
I noticed my balance was off. I fell a lot, and I had a lot of, I just couldn't remember a lot of things that were kind of root in my mind and memory.
So I was cussing everyone out. They're going off for no reason.
A significant side effect from my injury is also why you are listening to a computerized voice say this. My injury rendered me physically unable to speak, and I have to use my iPad now to communicate by typing out everything that I'd like to say and having it speak for me.
The neurological issues that I noticed later on were more having to do with feelings of just not being with it and not understanding where that was coming from. You know, it just felt like I was losing my mind.
Very, very sensitive to any kind of touch, any kind of anything. Just what you would think was a little pinch would be World War III for him.
I would hear ringing sounds. My hearing would go in and out. Very light sensitivity. I actually had like complex PTSD, which I was afraid to leave the house. Taste changed. Chocolate was horrible. My favorite candies were horrible.
I did have depression. That came on relatively quickly, actually, after the anxiety was the first, I guess, mental health thing that really crippled me. And then the depression followed along quite quickly with that.
Some of the complications that I had were definitely short-term memory. I had extreme fatigue at the time.
The silent epidemic. An individual can present with one or more of the effects in each of the areas previously mentioned and have no physical signs of trauma at all. A change in behavior may be the first signal of this invisible injury. Therefore, traumatic brain injury is called the silent epidemic. Individuals with TBI are often misdiagnosed and go undetected. TBI is hidden among those already receiving services in the areas of mental health, substance use, corrections, and hospital environments. Here are some important facts to know. In Alabama, over 6,000 newly injured individuals are hospitalized each year. A recent pilot study in behavioral health showed 4 key findings. First, 1 in 3 screened positive for a previous head injury. Second, the study further showed those with a suicide attempt were 2.6 times more likely to have a history of head injury and 1.14 times more likely to be diagnosed with a trauma disorder. Lastly, antipsychotic medications along with mood stabilizers were often prescribed as well. It is important to note that almost half of adults with TBI who have no pre-injury history of mental health problems may develop mental health problems after the TBI, such as depression and anxiety. Higher rates of TBI occur with older adults, teenagers, foster care, treatment and correctional facilities, domestic violence situations, and veterans. Children and teenagers with a TBI have a higher rate of diagnosis of ADHD, oppositional defiant disorder, conduct disorder, substance use, mood disorders, and anxiety. These conditions can occur into adulthood. Suicidal ideation can be 7 times higher in individuals with TBI. Veterans with multiple TBIs are twice as likely to consider suicide. This increased suicide risk persists up to 15 years post-head injury. Those who've misused drugs and alcohol before injury are considered more likely to misuse after. Substance use after TBI increases seizure activity, risk of falls, and sensitivity to alcohol and drugs. Behavioral health treatment for individuals with TBI. We have covered what is a TBI, when it occurs, possible effects, and why it is called the silent epidemic. Now let's discuss TBI inside behavioral health. There is a need to recognize individuals with a problematic history of TBI. A diagnosis of TBI should not undermine an individual's ability to participate in or benefit from common treatments. If a behavioral health provider is TBI informed, then from the start they can initiate appropriate referrals, accommodations, and treatments. Extensive expertise is not required to make simple adjustments or accommodations in treatment. All behavioral health services should begin with a brief TBI questionnaire. Allow yourself time to consider the effects from the head injury and which simple accommodations are to be made before the treatment begins. When providing treatment to an individual with a TBI, here is a list of considerations: unintentional multiple missed appointments and non-compliance, need for repeated instructions to ensure comprehension, focusing on deficits, extreme fatigue and processing overload, lack of emotion or flat affect. This does not equal lack of interest. Increased sensitivity to common medications, unintentional low motivation and non-commitment to change, large amounts of group work or memorization of multiple steps. To achieve better results, a treatment plan should address a daily schedule, cognitive activity, medication review, sleep, nutrition, and a supportive environment. TBI protocols or gold standard in treatment should include a brief screener or questionnaire that asks about history of head injuries, simple accommodations for neurobehavioral effects, a holistic approach for dual diagnoses and co-occurring conditions, creation of person-centered supports, support to increase an individual's TBI self-advocacy by including location and utilization of state TBI programs, TBI specialists, advocacy organizations, and/or peer specialists. Thank you for wanting to know more about TBI. Your understanding will improve the outcome for individuals with brain injury. For resources, screening information, advocacy, and support, go to alabamatbi.org.